नमस्ते बिटिया हमेशा खुश रहो बिटिया A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine at Faculty of Homeopathic Science in JAYOTI VIDYAPEETH Women's University, Jaipur. In today's lecture, we are going to discuss about aortic regurgitation. What is aortic regurgitation? Aortic regurgitation is the leaking of the aortic valve of the heart that causes the blood to flow in the reverse direction during ventricular diastole from aorta into the left ventricles. So what is happening in aortic regurgitation? There is leaking of the aortic valve of the heart and it causes the flow of blood in the reverse direction during the ventricular diastole. That is from aorta to the left ventricle. This condition is due to the disease of the aortic valve cusps or dilatation of the aortic root. The left ventricle dilates and hypertrophies to compensate for the regurgitation. The stroke volume of the left ventricle may eventually be doubled or tripled, and the major arteries are then conspicuously pulsatile. Now, what are the different causes of aortic regurgitation? There are various causes, but the causes can be broadly classified into two important parts: the congenital causes and the acquired causes. Congenital causes are the causes that are right from the birth, and acquired causes develops later on. So the congenital causes includes the bicuspid valve or disproportionate cusps. The acquired causes consist of the rheumatic disease, the infective endocarditis, trauma, and aortic dilatation. I will again repeat the causes. The congenital consist of the bicuspid valve or the disproportionate cusps, and the acquired cause consists of rheumatic disease, infective endocarditis, trauma, and aortic dilatation. Now, this is the pathophysiology. This is the thing that is happening. The blood from the left ventricle enters the aorta, but due to some congenital defect, there is bicuspid aortic valve with stenosis, due to which it does not close properly, and there is backflow of the blood causing aortic regurgitation. Now, what are the clinical features in case of aortic regurgitation? The clinical features can be divided into two parts: symptoms and the signs. Now, first of all, we are going to discuss about the symptoms of aortic regurgitation. The symptoms includes mild to moderate aortic regurgitation. In case of mild to moderate aortic regurgitation, the symptoms are usually absent. The patient is often asymptomatic, and he is aware, and there is awareness of the heartbeat that is known as the palpitation of the heart. In case of severe aortic regurgitation, there is breathlessness and angina. So, in mild to moderate aortic regurgitation, it is often asymptomatic, or sometimes there is awareness of the heartbeat with palpitations. In case of severe aortic regurgitation, there is breathlessness and angina pains. Now, what are the different signs in case of aortic regurgitation? The signs includes pulses. Whenever you try to palpate the pulse, there is large volume or collapsing pulse that is felt in the case of patient. There is low diastolic and increased pulse pressure. There is bounding peripheral pulses. So I will again repeat the pulses. The pulses will be large volume or collapsing in pulse. There will be low diastolic and increased pulse pressure, and there will be bounding peripheral pulses. Now we come to the murmurs. What are the different kind of murmurs? There will be early diastolic murmur and a systolic murmur. The other signs includes displaced heaving apex beat. There is pre-systolic impulse and crepitations. So you will get early diastolic murmur, systolic murmur, and the other signs consist of displaced heaving apex beat and pre-systolic impulse and crepitations. Now, what are the various investigations that could be done in case of aortic regurgitation? The investigation includes ECG. ECG will show left ventricular hypertrophy and T-wave inversion. The chest X-ray will show cardiac dilatation, and the Doppler echocardiography will show dilated left ventricle and hyperdynamic left ventricle. There will be cardiac catheterization and aortography and assessing the severity of regurgitation. The MRI is useful in assessing the degree and extent of aortic dilatation. I will again repeat the investigation. The ECG will show left ventricular hypertrophy and T-wave inversion. The chest X-ray will show cardiac dilatation. Doppler echocardiography will show dilated left ventricle and hyperdynamic left ventricle. The cardiac catheterization and aortography will be done for assessing severity of regurgitation, and MRI is useful for assessing the degree and extent of aortic dilatation. Now, how will you manage such a case? The management is done in the following ways. Aortic regurgitation can be managed by noting the systolic blood pressure. The systolic blood pressure should be controlled with vasodilating drugs such as nifedipine and ACE inhibitors. The aortic valve replacement has to be done, and aortic root replacement should be done. So there are three patterns of management. Number one, systolic BP should be controlled by nifedipine or ACE inhibitors. Aortic valve replacement has to be done, and aortic root replacement should be done. And this is the surgery of aortic root replacement. Now, this was all about aortic regurgitation. In the next lecture, we are going to discuss about myocardial infarction. This session is powered by Digital Version 2.0, JAYOTI VIDYAPEETH Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. We will be meeting in the next lecture tomorrow.